Good afternoon. Now we are going to talk about something really interesting, which is going on in the regenerative field, but also in regenerative hair transplantation. Let me introduce you to gentlemen. Or gentlemen, would you please introduce yourself?
My name is Dr. Asi Peretz. I come from South Africa, work in South Africa, Israel, and in Turkey. We're honored to work with Dr. Tunç over here and do a collaboration with him where obviously myself and I don't know if my brother wants to introduce himself as well.
I'm
Eric.
Dr. Eric Peretz. I'm Dr. Asi's brother. We're both from South Africa, and like you mentioned, we also are licensed in Israel as well. And we work in Istanbul, Turkey, the best place in the world for hair transplantation surgeries.
Yes, so I'm very glad that we are creating this wonderful team on regenerative hair transplantation. So as you might know, we moved our clinic from Nişantaşı to Nişantaşı. It's kind of like the center of Istanbul. Like now we are having a beautiful clinic, two floors where we have our hair transplantation operation rooms, regenerative surgery operation rooms, all the cutting edge like lasers, energy-based devices. We are just combining this with longevity also. We are working together with the London Regenerative Institute team, and like we are literally starting a new era of hair transplantation. So we created this new team with Asi and Eric to just really upgrade hair transplantation. Anyway, like Turkey is the center of hair transplantation. Yeah. Well, but yeah, I mean, would you just tell us like what is its difference that you are doing? Like how you make this better?
Sure. So I think how we make this better is by doing things correctly, doing them the right way. Also, we, the doctors, do all the processes of the surgery ourselves, as stipulated by International Society of Hair Restoration Surgeons.
That's very interesting. So you guys are doing everything yourselves.
Yes.
Of course, you have a team with you guys.
Yes.
But you are,
sport,
as doctors, as medical doctors, you are doing it yourself. Yes.
Yes, absolutely. Yes. So we are actively extract, we do channel creations, our team does implantation, but obviously if we're doing DHI method, if we're adding density to hair, sometimes we like to rather do direct hair implantation.
That's also important. That means like I don't need to cut my hair off, right?
Exactly.
So would you please like just roughly talk about the different ways of like doing hair transplantation?
Sure. So there's two different, and it gets quite confusing for a lot of people, but actually it's quite simple. So there's two different methods of extraction, okay? And then you have multiple various different methods of implantation.
Yeah.
But the two methods of extraction is something called the strip method, or FUT, and then FUE, or follicular unit extraction, okay? Now FUE is probably less invasive and, in my opinion, has a lot more benefits than FUT surgery.
So for my patients who are going to watch this, like FUT is like you take a strip from the back of the head,
yes,
but that leaves a scar. It's easier, faster, and cheaper.
Easier for the doctor, sure.
And FUE is you guys collect the follicles one by one, so there is no scar at all actually.
So we always say there is some scarring. So there's no such thing as a scarless surgery because remember it is a full thickness skin graft. We're taking the entirety, the whole mechanics of the hair follicle with this epithelium and the skin on top. So there is tiny little depigmented scars that are left, but as far as a large visible scar goes, absolutely not.
And it's very easily concealable once you grow your hair out. It's very difficult to see unless it's been over harvested, which is something we really focus on in our clinic not to do.
Right.
Okay, and regarding the implantation?
So regarding the implantation, there's two main methods. So there's pre-made slits, okay? So that means you go and you pre-make all your sites where you're going to implant the follicles. And then there's something called direct hair implantation. And that's when the hair is loaded onto a special, it's almost like a needle pen, and deployed directly into the skin. So pretty much you're making the incision and the implantation at the same time. That has some benefits, some advantages and disadvantages. But what I believe is you can get the best results with pre-made slits. But where the advantage of the direct hair implantation comes is that this follicle, remember, every follicle is like a little baby. They're so sensitive. That's also why we use induction.
I will talk about that.
That's
the new kid on the block. Yeah.
Exactly.
But let me just cut you. I think you guys bought a very, very expensive microscope. Why does it make a difference?
So yeah, we use our microscope in order to separate our grafts carefully so that we can choose the real single hairs, or if they don't have enough single hairs, we actually have to cut the follicle into single hair grafts to make the hairline look more natural. Because if you see a 4-hair graft in the hairline, it looks more like doll's hair and it doesn't look natural at all. So what we want
whereas
to
you have to have kind of like a gradual kind of like...
Exactly, yeah. We want to try and put the single hairs in the frontal hairline to soften it, and then you can add double hairs and then triple hairs more in the center where it creates better coverage.
Mm-hmm.
Right.
Okay, fabulous.
Yeah.
And what is new?
What is new? So right now we're working with Dr. Tunç, who's expert in regenerative medicine. He wrote a whole bunch of books here, reverse abdominoplasty, facial surgery, very complex stuff. Way more complex than hair transplants, that's for sure. What we're doing is we're working on different ways to promote hair growth faster after hair transplantation. Yeah, maybe you can tell us a little bit more about this follicular induction method.
Yeah, now actually that's really, really fascinating and also exciting for all of us. This is kind of like the center where all is coming out, the science. So what we do is called the induced follicle transplantation. When our doctors take the hair follicles out, we keep them in a bath of baby or like cord blood or cord blood based exosomes. So we are actually kind of like resetting the age of the hair follicles during these like 2 hours while the hair follicles are sitting in the bath. We are literally making them younger follicles out of them. And once they are transplanted, what we expect, and we have seen it, I mean,
yes.
The patient we just seen was amazing in order to just show, of course we have the science behind, but like clinically, we had a transplantation on half side with induced follicle transplantation, the other side normal, and then we followed the right side with also exosomes or exosome serum. And what we have seen is very interesting. First of all, the healing was much faster, right? The downfall of the transplanted hair is happening faster on the exosome side. And then the hair regrowth is faster. So it is not, and of course also the hair quality and thickness was better. So you could literally see the difference between a normal hair transplantation site versus the exosome-induced hair transplantation site. So what we see now is actually a faster healing, so a faster going back to normal life, a faster hair regrowth, and also stronger hair. So quality-wise as well as quantity-wise, we have literally updated our results. Now, of course, the question is where do we get the exosomes from?
Yes,
we were
it's
talking
cord
about
blood, and obviously there's an ethical issue with cord blood, but maybe...
But we don't take the cord blood from humans, we are taking calf cord blood. And actually, there is no ethical issue because cord blood is a waste material, right? Like normally,
True.
it is thrown away.
Yeah.
So it is a very green process. We are literally recycling a waste product and making the things much healthier, much faster, and much more like stronger in a way. So how it is done is like we collect calf cord blood, harvest the exosomes, and then we create a special bath to keep the exosomes during the implantation, but also we are having a topical cream and a topical serum for the hair, which is going to be available in the world very soon. But for the time being, we are keeping it for ourselves, right? So any comments about that?
Obviously, it sounds very interesting, and what I want to know is how does this differ to something like a stem cell, like Regenera Activa machine? Every hair follicle has its own stem cells. And there's a little device that kind of grinds up a few follicles and supposedly extracts stem cells from it. And then those stem cells are injected into the scalp. And
You are talking about that you take a small piece and then you...
Yes.
That's not stem cells.
Yeah, well, yes, exactly.
Okay, let me explain that to you. Like,
Sure.
basically, when we are getting older, or let's put it like that, until we get to ages of 20, we are growing. Then we stop growing, and then we start getting older. So our exosomes, which are traveling around blood through our body with our blood, when we are young, are carrying youthful messages. So in a boy or up to 20 years old, the exosomes, what you get from the blood, are young exosomes.
Right.
After the age of 20 and going down the hill, the destructive or old exosomes are getting higher. That's why we are getting older. That's why we are losing muscle. That's why our bones are getting worn off. And that's why we are losing hair, by the way. So what we do here is basically we reverse the ecosystem to youth. So when you take, like let's say when you do a hair transplantation at a patient at the age of 45,
Right.
the hair follicles are 45 years old.
Sure. Yes.
But when you add young exosomes from cord blood, you literally change the balance to youth. So you downgrade the age from 45, not to a baby age, but
Yes.
basically you rebalance it to a more youthful state. That's
Right,
why
yes.
they are much more powerful. Now, regarding the stem cells, if you get the stem cells from the fat and inject them, possibly they might work, but this is much easier because that doesn't need an extra surgery.
It's not invasive, right?
Yeah, and it says because they are as powerful as stem cell exosomes, there is no problem. And because they are animal origin, you can get them.
So we know that exosomes assist in cell-to-cell communication. Are you saying that the younger exosomes are actually giving messages to these older hair follicles and are helping them
Behave like
younger cells?
I am not saying it. It's science.
Cool.
So literally, there is a very interesting publication. If you take old cells from somebody and put them into an embryonic cell culture, you know what happens is like the old cells immediately become young, and that information is transferred through exosomes.
Yes.
Mm.
And exactly, if you get young exosomes into your blood, you get younger. Vampires knew.
I heard they did just a little bit off topic, but also exosomes, that they're excellent at delivering things into cells. And there was a study done in mice, lung cancer that was resistant to treatment, and they embedded these exosomes with the cancer treatment, and those exosomes delivered that treatment. They had like a 50x cytotoxic effect on the cancer itself, which is very interesting. I mean,
And that's exactly what we do. Basically, we are not using exosomes, we are using hybrisomes. And what we do is, we take cord blood exosomes, which have the keys to enter the cells.
Okay.
Then we take liposomes filled with hair, like with active ingredients to help hair growth. We put them together, we fuse them together to create hybrid exosomes. All right? And these hybrid exosomes now have vitamin B's, etc., which is supposed to be given to the follicles, but they have also youthful information. So it is not only exosomes what we provide, it is actually a hybrisome which works also like a cargo ship. So imagine a ship which carries the weapons, but also the cargo.
Yeah, so it's all so interesting, and we really can't wait to really start incorporating this.
Hopefully it will be, it will be very soon available all around the world. But for the time being, unfortunately, you have to come here to us.
Awesome.
So I think we have to wrap up. I thank you, and you guys, any last words?
Thank you so much.
That's been very informative.
Yeah.
So thanks very much.
Have a good evening.
Have a good evening.
Bye.